Thank you for joining us. It's always a pleasure to speak with our customers and hear about the success they're finding with HealthStream products. Today, we're speaking with Chris Paravate, Cheif Information Officer at Northeast Georgia Health Systems. Chris and his team implemented ShiftWizard, a healthcare scheduling solution. The results are tremendous. So without further ado, let's hear from Chris.
We really did want a healthcare design solution that was focused on the dynamics of those needs, also would integrate well into our time and attendance, and ultimately into our HRIS system, which is Workday. And so for that to be cohesive and simple, and ultimately, whether you were a staff member, or you're a manager or director, to be able to use and interact with just a handful of tools versus having an abundance of tools and too many ways to do things was a really big piece of what we were hoping to accomplish with the overall architecture. You know, I think several aspects jumped out, you know, that we heard from our frontline users. One is the usability, the ability to support various needs and the diversity of needs that were out there. Our clinicians have choices, right? Frankly, they can work somewhere else, and so a lot of times that scheduling experience, that onboarding experience, simple things like training and delivery and the architecture of tools, those everyday things can either be a source of frustration, or they can be, gosh, this is so easy. It's so easy for me to pick up a shift here. It's so easy for me to be able to engage with my manager and address things that have come up. And that was really a big piece of this, and our selection. The integration with Workday. Workday is our ERP system. It is our payroll system. So the integration with Workday and with time and attendance with Workday was paramount. How we're supporting those tools and how streamlined they become is super important, especially when you're trying to make changes as the organization changes. You know, the integration was never really a challenge for us. It just worked. We had really good collaboration between the Workday team and the ShiftWizard team. I felt like I could escalate issues to either side, and there was good communications and reconciliation and ownership. You know, we run a really tight project management office here, and I'm intimately involved in those programs because it impacts the entire organization often. And you know, the part of our culture and worked well with ShiftWizard and with Workday was to be really open and honest about issues and concerns, and to really aggressively go after those things. Not because individuals didn't do something, but because we needed individuals just to act and to respond and to address issues. And we had a really good team, a very constructive relationship, and that really, I think, led to a very smooth go live. What I would tell you is, one is consistently we had a tool and the analytics to support whatever we were focusing on. As an overarching metric, we look at turnover. And what we are seeing is our turnover rates are going down, and the amount of agency staff is also coming down. ShiftWizard is definitely part of our long-term architecture. I just came from a meeting just prior to talking with you, and one of the things we were talking about is enhancing nursing communications, particularly around this area of work. And one of the nursing leaders, you know, piped up and said, you know, ShiftWizard can help us with that. There's a piece of communications that I'm using, And so we're still seeing a lot of different adoption of tools out there. We take our partnership with ShiftWizard and Workday very seriously. So I'm a very active member of connecting with leadership at both of those organizations and want to remain connected. Healthcare is changing rapidly. We're changing rapidly. And we want to continue to stay connected because we think it's the right platform, the right capability, the right level of integration. We think it's simple. We think it's scalable. We want to continue to be part of that innovation.